doc, what can I use to get rid of this melasma on my skin? This is a question that I get often because in my clinic, I help patients look gorgeous on the outside and the inside, right? So melasma is what I want to talk about today. And if you're new here, please subscribe to this channel, like this video, share it with someone that it can help, and comment in the comment section if you're struggling with this problem and all of the things that you might have tried to, alleviate it. Whether it's worked, not worked, add to the points that I'm going to make here so we can help other patients get better. Okay, so what is melasma? This is a discoloration of the skin that we tend to see in certain ethnic groups that basically shows up sometimes randomly, seems like, but we are finding that there are some associations or things that might trigger it, and we need to understand those things so that maybe we can better manage it. Okay, so melasma causes this darkening or discoloration of your skin, usually in patches, right, on your face. Very noticeable, where you feel like you have to constantly cover it up with makeup, and we tend to see it in women more often than in men. And we tend to find that in some patients, pregnancy itself, the hormonal changes that happens in pregnancy can trigger it. We have also seen it in patients receiving hormone replacement therapy as a rare complication, right? And also we have definitely seen it in patients that are on oral birth control pills, right? As far as pregnancy prevention methods. Patients that can also develop this often are patients that have a lot of sun exposure, but genetics does play a role into that, because not everybody that goes in the sun gets melasma, right? Some people just tan really nicely and they look cute, but for some people, they develop this, discoloration or patch of discoloration we call melasma. So more common in patients that have darker skin tones. So we say that we typically will see it in patients that have what we call Fitzpatrick from like 3 to 6. So if you don't know what Fitzpatrick is, you can just Google that. It's the Fitzpatrick scale is a way that we rate the skin from very fair, light skin to very dark skin. And it tells us, how much a skin might be making melanin and, things like that. So it's kind of a classification that is accepted worldwide, where we all can use the same language to describe the color that we're describing. So Fitzpatrick type 3 through 6 will be an example of someone with melasma. So I would fall in this group. So I'm very careful about all of these things that I'm talking about today. So hormonal changes, like I said, can happen because you're reaching that menopausal age or you're reaching that andropause age. And you can start experiencing some of this discoloration in your skin because of that. In patients that are pregnant, we just know that this fluctuation, the huge fluctuation in the hormone because of pregnancy can trigger it. And then in those patients that are just on oral contraceptives and they didn't know, they just took it to prevent pregnancy, and all of a sudden they start to develop melasma. So those are some of the things that we know definitely cause it. Now, if you are in a certain type of ethnic group, so we find that Asians would usually develop this more often, Middle Easterns, we find Africans, and we find patients that have Indian descent, right? So a lot of times, if I see someone with melasma, there is some history in their family, someone that has a bloodline from those ethnic groups. Okay, so understanding that sometimes someone might look kind of on a fairer side but can still develop melasma, that is because deep down in their DNA, okay, it's still some African descent or Indian descent or so on and so forth. Okay, so that's very important to take a thorough history when you're dealing with melasma. All right, so we see more prevalent in women, like I said, and we also see it in patients that are more sun exposed. So one of the ways to prevent developing melasma is to protect your skin. Protect it by using protective clothing, hats, and so on, but also putting on sun protection, like sunscreen, okay? So we know that those are reasons. some reasons that we might not, realize in some patients that we treat, especially in, internal medicine and so on, is medications. So medications can trigger melasma, believe it or not. And the most common one that most of you might get exposed to without realizing it are antibiotics. So there is a class of antibiotics we call tetracycline or the cyclines, and they specifically have been known to cause sun sensitivity, which then causes you to be more likely or more prone to developing melasma. Okay, so tetracycline we use to treat things like Lyme disease. We use it to treat, some dental infections, some, bacterial infections and different things. So it's not uncommon that you can come across this type of medications. Okay, so also we see melasma developing in patients that have been exposed to phenytoin. So phenytoin is a anti-seizure medication that we would use to control epilepsy and absence seizures and different types of seizure disorders. So very common again in patients that are having this issue, that they've been given this medication to treat their seizure, and all of a sudden their skin is now manifesting this problem. Okay, so what happens once you get melasma? Okay, it's not something that's very easy to just say, oh, wait it out, it's going to clear. Okay, we find that a lot of patients, it becomes this nagging problem that doesn't go away. Okay, they do their little nighttime routine, their daytime routine, they use their sunscreen now and all that, but it seems like they can't get rid of this problem. So a lot of patients end up going to the dermatologist to have them prescribe something for this, because they don't want to have to wear makeup all the time. When they don't feel like wearing makeup, they have to just cover this little patch of darker skin off, right? So patients would like to get it treated so that they can kind of be happy with their naked skin again, right? So one of the treatments that we use to treat this is hydroquinone, okay? So hydroquinone is very, very commonly used, and the way it works is that it basically lightens the dark patches on your skin by decreasing the melanin that area of your skin makes. Okay, so you take the cream, you rub it on there, and every day you leave it on for several hours, and it just tells that part of your skin to stop making so much melanin, right? Because melanin is what gives the skin that darker tone, right? So by applying this cream, you can then reduce the discoloration in that patch area. Okay, so hydroquinone is one of the options we can use. The other thing that we will commonly see used is, I call it tretinoin. I might be saying it all wrong, everybody says things different. But tretinoin is what we use because it will promote the skin cell to turn over quick, right? Quick skin turnover or skin cell turnover is going to encourage new skin to now come to the surface, so that this one that's been triggered or damaged or darkened can fall off, and fresh, new, less discolored skin can come to the surface. So it will shed the old skin so the new skin can look nicer. Okay, so that's what that is. Now we have, some dermatologists will combine corticosteroids with some skin lightening cream, and they will kind of combine that and give that to the patient to apply to the area. Again, what is that going to do? We know sometimes corticosteroids can thin the skin, but they can also help these skin lightening creams to reduce inflammation and get in there and really start to help that area, right? So it's kind of helped to increase the effectiveness of the skin lightening cream, but also helps to reduce the inflammation that's causing that melanin to overreact. Okay, so some patients are given the treatment of chemical pills, and chemical pills can work. Be very careful as a darker complexion person getting chemical pills. You really have to make sure that the dermatologist you're going to, or the skin specialist you're going to, your esthetician, is experienced in treating people with your Fitzpatrick skin type. Because chemical pills itself, if not done right, can actually predispose you to having this problem, right? If they do too much, they irritate that melanin cell, then you're going to make more. And in that case, you will end up having even harder, you have worse problem when you're done. But chemical peels helps to remove the affected skin layer, and that's the idea. You peel it off, and then you get new skin, and that can help you with the melasma. So in my clinic, I also use laser therapies. Laser therapies are, machines that, we can apply to the skin. One specifically is a intense pulse light, or we call IPL. And IPL can help to reduce the pigment production in the skin by basically sending a specific wavelength of energy into the skin and telling that melanin to reduce production of this pigment, right? So lasers can work very well. Most of the time there will be multiple treatments, maybe a series of 3 to 6 sessions for you to get the result you're looking for, but it is a non-invasive option that you can definitely try. Doesn't introduce any chemicals into your skin or into your body in case you don't want to take any of these medications, because they do have some toxic side effects, right? So that is an option. Laser is one of the things that I do use in my practice to help with this problem. And then finally, I'll talk about also, some oral meds like this tranexamic acid. Tranexamic acid basically reduces the inflammation of melanin in the skin, and this can also be prescribed to help with this problem. Okay, so one of the things that I definitely want to encourage is that you have to protect your skin. Okay, don't be fussing with your skin too much, especially as you're getting older to that perimenopausal age, because these hormonal changes already predispose you to this problem. Now you start messing with your, pimple or, hairs, and doing all these things that constantly irritate your skin, and that can start to trigger you to start having this problem. So those are the things that you kind of want to look out for, that you can do to prevent it. And of course, instead of taking oral contraceptive pill, maybe use something like an IUD, as a copper IUD, for example, as a birth control method, or maybe have your spouse be the one that does the birth control with the vasectomy, so that you don't have to introduce hormones into your body that might cause this problem, especially if you fall into these ethnic groups or this type of Fitzpatrick skin type. Hope that has been helpful. Again, if you're having this problem, whatever you've done that has worked, whatever natural options that you might know about that might help other patients on this channel, drop it in the comment section below. I would love to read about those and do some video on other options that are non-prescription that you can use to treat this. All right, I'll see you guys on the next one. Bye for now.